Oregon reported him as the youngest COVID-19 death in the state at 26 years old. But Matthew Irvin's parents were always suspicious.
They did blood test, and the white blood cell count was elevated, so they just said it looked COVID-like, basically. From early on, I felt that the COVID diagnosis was incorrect.
Irvin's coronavirus test came back negative a few days after he suddenly died. Neither Yamhill County nor the state medical examiner's office would do an autopsy. The state says it didn't do one because it's understaffed.
They didn't look at it differently, that they assumed it was COVID and should have done an autopsy to find out why this young man died.
In search of answers, his family hired a private pathologist. But that autopsy came back inconclusive.
He said it was definitely related to the lungs, the blood clotting.
The state advised Yamhill County send Irvin's lung tissue samples to the CDC for specialized testing. Turns out, the family's gut feeling was right. The CDC found no evidence of COVID-19.
Now where we're at, what happened? What happened to our son? How can we save other people's lives?
When including him in the death count, Oregon Health Authority went off Irvin's death certificate, which listed COVID-19 as a cause or condition contributing to his death. The state reports people who died from COVID and with COVID as the same thing, and says it's in line with national recommendations. Wednesday, OHA announced Irvin's death certificate no longer says COVID-19, and it took him out of Oregon's death toll. But the family worries Oregon's tracking paints a blurry picture and skews the numbers.
I'm sure there's a lot of people who lost loved ones that are questioning.
They also feel their son could have gotten help if doctors didn't assume he had the virus.
He had a big heart, and it was way too early to take him.
Yeah, for sure.
We just want closure. I mean, it's been ripped back open drastically, and
Morgan Romero,
it's really hard.
KGW News.